Hi everyone, I'm Marian Tungpalan. On this video, I'll be giving you the steps in giving a perineal care to a client with female genitalia. So usually, rooms of our client are being closed, we're being occupied. So we need to knock the door so you can enter now the room. Please consider and apply all the times the principles of DIPS, whatever you're doing to a client. So first of all, you need to introduce yourself. So, my name is Marian Tupalan, something like that. Then, you need to ask the name of the client. You can check the name, like for this client, for this woman is Mrs. Joy Smith. So, you can verify the name of your client on her name badge. Once verified the name of the client, don't forget to explain the procedure, what has to be done today. Usually, as part of interaction, you can ask question, how are you today? Something like that. A sort of question for you to become more to have an interaction with your client. Don't forget, when entering the room, you should prepare all the needed materials and supplies in order for you to get rushed and getting something and like that. At the same time, you need to do the personal hygiene, like washing your hands. If in case there is also other people in the room, you need to have privacy. You can close the curtains, and don't forget closing also the curtains from the window and even the doors itself. Then next, you need to raise the bed into a comfortable working height. Then it's up to you if you want to lower the bed near you. Then next, you need to cover the client with a bath blanket. Then fan-fold the top linen to the foot of the bed. Drape the client. Expose only the perineal area. This is also to maintain privacy. At the same time, to avoid chilling. Fill the wash basin, then measure the water temperature according to the employer's policy. Place the basin on the overhead table or work area. Help now the client to flex their knees and spread their legs. If in case the client cannot flex their knees, you can help them as much as possible. So it's now time to put the gloves and wet the washcloth. Apply soap if used to wash a cloth. Use your dominant hand to separate the client's labia. On the first stroke, wash the labia on the side that is farthest on you. On the second stroke, should be wiped closest to labia. Using the clean section of the cloth, perform the third stroke. Wiping down on the center of the perineum, cleaning from the pubic area toward the rectal area. If the area is soiled, repeat the stroke until it's clean. Pat the area with dry towel. Fold the blanket back down between the client legs. It's now time to help the client to lower their legs and turn down on the side away from you. Apply soap to the wash area and clean on the rectal area. Rinse the area with a washcloth. Pat the area with dry towel. Remove the water pad and remove your gloves and wash your hand and ensure that it's clean. For post-procedure, you need to maintain privacy, safety, and comfort. So you need not to bring back and return the client. Then wash your hands. Return the bed on its lowest position and ensure that call bell is strategically located. The client can easily reach. Empty and clean the wash bin. Return the basin and other supplies or materials on its original location. Wipe off the overhead table and work area. Follow your employer's policy in handling dirty linen. Report and record your actions and observations according to your employer's policy.